to Cindy. Thanks, Cindy.
Yeah, thanks. Thanks for having me. And I'm going to go ahead and share my screen. I just want to show everybody where you can find the most recent data. So can you guys see our website there? Let me know when you can see it. Yeah, we're good? Okay, so this is our new website. You used to be able to go to missoula.co/cvirus, and if you go there, it should automatically redirect you, but some people, depending on what your internet settings are, it may not redirect you. So if you want to get there more cleanly, then the easiest way is to go to missoulainfo.com. As you can see right here on our homepage, we basically updated this today to show what our current goal is. Many of you probably already know, but if you did not know, Ellen Leahy, our health officer, did issue a new order to help try to achieve the goal of a 7-day rolling average incidence of new cases per 100,000 population down to 25 for 2 consecutive weeks. We've been seeing a fairly significant increase in cases over the last several weeks, and many of our cases are shifting to the older demographics of people who are at higher risk for bad outcomes. And we have seen an increase in the number of deaths that we've had in Missoula County. And so hopefully this new order of limiting business capacities to 50%, reducing gathering sizes to 25 people, and closing bars at 10 p.m. will help to reduce the number of new cases that we're getting. So if you go up here to the top and you go over to this little data tab, you can click where it says Missoula County, and that's going to take you to the page where you can see the numbers. This first table gives you this is yesterday's numbers, or this is today's numbers, and then next to it is yesterday's numbers. So today we had 21 new cases. Yesterday we had 60. That's not really that abnormal. Sometimes we'll see that we just have an influx of a huge number of new cases in one day, but all of the days surrounding it, like I believe that we've been between 60 and 95 cases for the last several days, and then today we were down to 21. If you scroll down, you can see that this gives you the average daily new cases per 100,000 people in the past 7 days, and that is where you see that number of 49, and that's where we're at right now. And the goal is to get that down to 25 or fewer for 2 consecutive weeks so that we can lift restrictions. If you scroll down on this page, you can see some of the trends. So this first graph is showing daily new cases plus this line that shows the 7-day moving average. And this is since August 1st. The next one is the same data, but it's only for the past 2 weeks. And then if you look at the next graph, this is showing you our active COVID cases in Missoula County since August 1st. And you can see that drop where we went from 60 to 21 new cases in a day, and we'll see what happens tomorrow, but I suspect it's likely going to go back up. Oh, oops, hang on, I think I lost my spot there. So this next chart right here is showing active cases by age group in Missoula County for today. So a few weeks ago, actually I think even just over a week ago, the number of 20 to 29-year-olds was closer to over 30, and a few weeks ago it was actually over 50%. And now what we're now seeing is that people in these age groups over 40 is starting to make up a bigger and bigger portion of our active cases. This next graph is showing route of transmission for current active cases in Missoula County. We are happy to see that the close contact to a confirmed case is increasing now. Last week it was decreasing in the number of People that were contracting it that were not a contact to a case was going down, and community spread was going up. So we're glad to see that trend changing. That's definitely a big control measure, is being able to identify those cases and those close contacts and get them into quarantine and isolation and get them tested. When we start to see the number of community spread going up, then that is when it starts being really concerning. And again, this is just another way of looking at the weekly average number of cases by age group. And you can see that, you know, the 80 plus is definitely up there at the top. So another thing that we look at is our weekly positivity rate. And it's actually gone down a little bit in the last week. Last week it was fairly high. So this is something that we really want to keep under 10%, and the lower it is, the better. But you can see it's kind of, we had a big upward spike and it's kind of dropping just a little bit. So I just wanted to pull this up and show you where that data can be found. Again, if you go to missoulainfo.com, and on our homepage here, you can see what our current goal is. If you scroll down, it gives you some links to the different ways that the different things that are most popular searches. And then the resident feedback portal. So if you want to be able to send a message to us about how you feel about how we're handling the pandemic or anything like that, then you can put that in there. This is going to be different than if you want to file a complaint. If you see that there is a business that is not following the health officer orders or the mandates, then that's where you see this little paragraph at the top where it says, please email envhealth@missoulacounty.us or call 258-4755. That's where you can put in any kind of complaints about a business or an organization that you don't think are following the directives. And for everything else, you can just put it in that resident feedback portal right there. And you can follow these links at the top. You can see that we've got a link for jobs here, for short-term employment opportunities, for the kinds of people that we're still looking to hire those positions. If you go to data, there is the Missoula County data. There's one for the University of Montana. There's the state dashboard. This is about COVID-19, so it's basically giving you symptoms and stuff like that. If you go to the briefing, this is our weekly briefings, which I did not have time to do one today, but there will be one tomorrow. If you go to this testing tab, you can see that we've got the other testing clinics in town if you don't want to come to our Missoula County Health Department testing clinic, and then state and local orders and FAQs. So I just wanted to share that, and that's kind of where we're at right now. We're definitely seeing that big increase in older age groups, which is definitely what is contributing to us seeing more frequent deaths in our community and more loss due to COVID-19. So with that, I will turn it over to you, Sarah, or open up for questions.
I have a question.
Thanks, Cindy.
Yes, go for it.
So let's go down maybe by council, and each council can ask their questions. Does that sound good for everyone tonight? All right, so we'll go council alphabetical order and start with Bonner. Bert?
Yeah, okay, I had to find the right microphone button to hit. And Cindy, I have a question. Surprise, surprise. In your things, you've got one that says voluntary stay at home. Everything else is pretty specific, but that's a little ambiguous. What are you expecting out of the population here with voluntary stay at home? Could you hear me?
Yeah, we can hear you.
Yep, we can hear you. Cindy, are you still there? You're on mute.
Cindy's still on mute.
Cindy, you're still muted.
Hey, sorry, you guys, my internet kicked me off, so I totally missed whatever question was asked.
Okay, Cindy, this is Bert Caldwell. The question was, all of your things that are starting tomorrow morning are fairly specific except for the voluntary stay at home. That's a little ambiguous. What are you expecting out of the Missoula population?
Yeah, so the voluntary stay at home was basically to say if you have the ability to stay at home, if you can work from home, if you can avoid social gatherings, then it's recommended at this time so that we can have an opportunity to try to get those case numbers down. We know that that is not possible for everyone. But we do want people to consider that if you have the ability. It's a good thing right now to just kind of pull back and hunker down and let's see if we can get our case numbers down.
Okay, thank you.
Emily Herndon from Bonner. Question regarding hospitals. I saw the hospital numbers. What do those numbers look like in comparison to overloading our healthcare system locally?
Yeah, so I look at the hospital numbers every day. I have access to, it's a program called Juvari that tells us how many ICU beds we have, how many med-surg beds we have. At this time, our hospitals are continuing to do elective surgeries, but they are starting to pull back on those so that they can make sure that they've got the availability for beds in the hospitals. And so I think that we've still got some room to move on that. They haven't completely stopped doing elective surgeries at this point. And so once they stop doing elective surgeries, it's going to open up that hospital capacity. But we do know that there are a lot of other hospitals in the state that are diverting because they've got so many cases that are hospitalized that they're overwhelmed. And that's even with them not doing elective surgeries. So we're prepared and they have plans for scaling back and opening up more beds if needed, but right now we're doing okay there.
Thanks, Cindy. So over to East Missoula. Lee, do you have any questions?
No, not at this time. Can you hear me okay?
We can, thank you.
Okay, thank you.
And down to Lolo, Kevin or Warren?
Yeah, Warren, go first if you want.
I'm fine, Kevin, go ahead.
Okay. Hey, Cindy, I appreciate your help. A week or two ago, I had some specific questions, and you were very helpful. Appreciate that. I got a question about the hospitalizations, and then also, it looked like that chart had some severe numbers for the 80 plus age group. So out of the hospitalizations, is that what we're seeing is some of the older folks more advanced in years that might be susceptible? Is that, or what type of hospitalizations can you tell us?
Yeah, that is what we're seeing is that as we start to see more cases in people that are older, we know that as you age, you tend to have more chronic health conditions, other things that are going to put you at risk for having bad outcomes from COVID-19. And so as we've seen that shift into those older age groups, that is why we're seeing more hospitalizations and unfortunately more deaths from COVID-19. We have had a shift where we are seeing cases that are popping up in our senior living facilities, and that's also contributing to those additional hospitalizations and bad outcomes.
Okay, good. I appreciate that answer. And then the other thing, just from my perspective, it looks to me like these numbers are climbing. And in the spring, when the state was shut down, the numbers were really, really low, kind of almost to what it looks like our daily goal is trying to be, for your 2 weeks. How come we haven't had a big shutdown from, the governor with these are some really high numbers?
Yeah, so we know that the economy can't really sustain a big shutdown, and that's why here in Missoula County we've tried to figure out ways that we could do some scaling back without absolutely shutting everything down. And so that was kind of what, when everyone else was reopening really quickly and we were saying, wait, let's hold on, let's pull back a little bit, let's, have some orders in place so that we have somewhere to step back to. Now we're stepping back to some of those levels. I don't think that the governor is going to put any kind of a statewide shutdown into place, but in public health, we never really know what the governor is going to do until he does it. And so that being said, that is why we're taking steps in Missoula County to try and have these additional factors in place. And if we go a couple of weeks and we continue to see an even more rise in cases, and our 7-day average new caseload per 100,000 people continues to go up, then we're going to have to look at other additional restrictions. Unfortunately, I know a lot of people don't like the idea of that. And, we definitely don't want to hurt the economy, but we really need to get to a point where we can get control of this.
Yeah, so it looks like, as far as controlling it, I don't know if it's possible to stop it. Is there a paradigm shift in the mindset of managing it as opposed to preventing it or stopping it?
Yeah, and that's been pretty much the goal all along, is being able to manage it. And the thing is that here in Missoula, we were able to manage it really well until the last month or so. And so, we know that if we've got capacity for case investigation and contact tracing, and if we've got healthcare infrastructure capacity and, and people are doing the right preventative things, then it's going to help us to control the pandemic. We were lucky enough to be later in the pandemic before we started seeing significant spikes in cases. So yeah, we know that we're going to probably be dealing with this for a long time to come. And so figuring out ways that we can manage it without absolutely having to shut everything down is what we're trying to do. And the early shutdown in the pandemic was really because we were trying to buy us some time. We needed to buy time to have testing capacity, and we needed to buy time so that we could make sure that we had the appropriate PPE for all of our healthcare workers. And now it's more a matter of trying to just manage it.
Okay. Well, I will say the process I experienced going through the testing phase seems pretty well streamlined and pretty efficient. So that's a compliment to your operation. So good stuff. That's all the questions I have. I appreciate that.
Thanks, Kevin.
You bet.
All right, Klaus and Seeley Lake, you had a question? Klaus, you're muted.
Good point.
There you go.
It's similar to Kevin's question. In the beginning of the year, we were the poster child on keeping cases down and so on. And then suddenly now it exploded, what seemed to me, almost out of nowhere. So my question is, what caused this? Was it the fact that the restrictions aren't in place anymore? Was it tourism? What took us from hardly any cases to an explosion of cases?
So I think that there's a multitude of factors that really contributed to the increase in cases in the last month or so. First and foremost, I think that people have gotten really comfortable being around, their extended family members and their friends and their coworkers, and people are really COVID fatigued. They're tired of being told that they need to be careful, that they need to practice social distancing, that they need to wear masks. And so a lot of those behaviors that people were really diligent about early in the pandemic, they stopped doing with the people that were closest to them. And that was when we started seeing these friend, family, coworker clusters. The other additional thing is that we've we know that people that are older are more susceptible, and once it started getting into our senior living facilities, that also caused a big spike in cases. But the big spike actually really occurred in those 20 to 29-year-olds that were really seeing, you know, they were tired of being told what to do, and they were basically saying, oh, well, if I get it, it's just like a cold. It's not really going to affect me. But then them getting it was what caused it to shift into our older age groups. And so I think it was a combination of different factors that caused us to see this really recent spike. The other thing is, you know, we're going into winter and people are congregating indoors more frequently, and that's also contributing to it.
Okay, thanks.
Tom and Seeley, did you have a question at all?
No, I think my questions have all been covered by the previous ones. Thanks.
All right, over to West Valley. Jerry, do you have any questions?
Yeah, I do. I have actually a couple questions. When we read the numbers about the out-of-county hospitalizations, am I assuming that's just because Granite County doesn't have a hospital? Seeley Lake doesn't have a hospital? Is that what those numbers pertain to?
Those numbers are actually attributed to people who live in surrounding counties like Mineral County or Valley County. Some of the counties that have smaller, and Granite County, that have smaller hospitals, but they don't have really good critical care hospitals. And so Missoula County has always been a healthcare hub for all of our surrounding counties, and that's why we're seeing that push from out-of-county cases being hospitalized here.
Okay, and then my next question, probably one that we're all, you know, not wanting to see or hear. What might other restrictions look like?
So I think that other restrictions, if they had to come down the track, would be different things like reducing capacity again. Maybe we go from 50 to 25%, reducing group sizes from 25 to 10, further restrictions on bars and restaurants. I am not sure what other restrictions that we can do. We talked about doing smaller group sizes, but we don't want to cut out the ability for people to participate in really structured group activities, such as the things that, you know, the kids go to after school care with Parks and Rec. And if we went from 25 to 10, then it would prohibit some of those really structured group sizes from happening. So, I mean, there are further things that we can do, but we would really hope that what is in place now will really drop our case numbers to the point where we don't have to move farther into restrictions.
Yeah, thank you. That's all I had.
All right, Tom Tucker in West Valley, did you have any questions?
Not at this time for this group.
Okay, thanks. And Bert, you raised your hand. Did you have one more question before we wrap up with Cindy?
Yeah, I did. I had one more, and that is, how much of the contract tracing takes us back to people from Ravalli County that are coming into Missoula?
So we have had some people from Ravalli County that interface with Missoula, whether it's because they're here for work or family or anything like that, but it's actually surprisingly a fairly limited number. So the majority of the cases and the spread that we're seeing are really, you know, people that are not taking precautions with their friend groups or not taking precautions with their family members who are outside of their immediate household or in workplace settings. So not a lot attributed to out-of-county people coming into Missoula County.
Not the answer I expected, but thank you very much.
All right, Cindy, that wraps it up for our questions. Thanks so much for being here with us tonight.
All right. Thanks, everybody. Have a good evening.
Absolutely. Thank you very much, Cindy.
See you, Cindy. Thanks.
Bye-bye.
Rob?
Yes, hello.
Great. Thank you. Aging Services.
Absolutely. So thank you for the invitation to come talk to this group. It's much appreciated. Nancy, thanks for the referral. We work with Nancy and the grants office very heavily with some of our programs, and we really appreciate her leadership and her stewardship of the program. So thanks for having us here. So I'm going to share my screen here and just give you a little bit of base information about Missoula Aging Services for those of you who may not know about us, and then I'll take some questions when we get toward the end of it. So Missoula Aging Services, we always like to start everything that we do by talking about our mission statement, because that is really what guides our work here. And the mission of Missoula Aging Services is to promote the independence, dignity, and health of older adults and those who care for them. We actually require that our staff be able to rattle that off on a regular basis. And the reason we do that is because of the key words independence, dignity, and health. And you'll see those in most of our processes that we do through the agency. So we try to do our mission through several different pieces. We call it our 4 legs of the table that hold us up there, with advocacy for formalizing what we want to see done for our community and the aging population, educating people on what services may be needed, or some training and help on healthcare or any of those type of pieces. We also do a lot of direct services to try to provide supports for people to remain independent in their home. And of course, we do consider ourselves a volunteer hub. We, at this point, although COVID's taken a toll on this project, we are sitting at about 650 active volunteers within Missoula Aging Services at this point. Active is very limited with what they can do now, but they're still fighting to find their way through it. So why does aging matter? So these numbers might shock you. This is the 2000 census versus the 2030 census estimates of what they're saying from the US Census Bureau. What we're expecting to see is some real changes in the population of the older Americans. People are living longer. We've got that large generation, the post-war generation that's there. And what we're looking for is to see the group aged between 60 and up growing from the 2000 census, where we were 17.6% in that age group, to expecting in 2030 to see 31.4% of the population being 60 or older. Why is that significant? Well, oftentimes those are the folks that take up a lot of the resources in the community services. So we want to make sure we're keeping a good eye on what's going on with that. So one of our big focuses is trying to keep people, individuals, stay at home. And a lot of times people don't understand why that's important, why that's critical. Well, first of all, it's what they want. That's what they want to be able to do. They want to age in place. It's also a lot cheaper than institutional living. Anybody who's had a loved one go into a nursing facility or those facilities where their Medicare, Medicaid's not paying for it, they're extremely expensive. It can really wipe out a lot of people's resources. It also can reduce how fast people age and how their chronic diseases progress. The happier, the more comfortable they are at home, assuming they can live there safely, does prevent and reduce the disability development in older adults. It's been very well proven. Going on to that preventative, we're trying to build that piece of what the people can do to take care of themselves and give them the supports to do that, and also helps them remain vital community members, which is really important for people to have a purpose in life and something that they think they matter, and something where they really work on what they do. So programs at Missoula Aging Services, I'm going to run through these pretty quick. If people have any questions at the end, I'm happy to go back over them. Our resource center, we've got 6 resource specialists, including 1 embedded in Seeley Lake at this point. They're there to help with Medicare and Medicaid counseling, options, a lot of dementia conversations with families, and just basically giving people the information they need to either help their families age or to help themselves transition into the aging or retirement world. We like to consider ourselves a volunteer hub. Like I said, hundreds and hundreds of volunteers, everybody from foster grandparents helping out in the schools, who actually, we've got a new program that we just started last week that we got some tablet computers into the hands of some of our foster grandparents and senior companions and trained them on how to use them. They're set up with cellular service, and the foster grandparents were able to read books and do things with the students directly this week. Fabulous programs, made a huge difference for us. Our senior companions help people stay at home as long as they can by helping them with grocery shopping, just companionship. Our RSVP program helps people out in the country, or out in the community in bed. We've got them at the Sheriff's Department, at the food bank. We've got them all over the place in Missoula County, and they're very effective. And then we also have our in-house volunteers who help us with what we can do here at the agency and help us be a little more effective. And right now, Meals on Wheels drivers have been an absolute godsend. You'll see some numbers on what we've been doing in COVID times with Meals on Wheels, but right now we're averaging about 80 to 90 drivers a month taking part and making those check-ins with people going back to anybody who's homebound at that point. We also have a family caregiver support, and what we're transitioning into an in-home support group with respite homemaking, some classes that we can help with. We have an Alzheimer's support group for people whose family members are going through dementia and that just can get there to talk. We've also just received $1 million grant from the ACL, the Administration on Community Living, to actually improve services for people with dementia in Missoula County. We're in the process of proofing out that grant now, and we'll start providing some more services in January. We also do the Ombudsman program. You just heard about the level of infection of the COVID that's going on in the assisted living and nursing homes. That's something that we've been keeping a real close eye on. We haven't been allowed into the facilities since March, but we do represent the rights of those folks that are in the facilities and try to help them get what they need and help them if there's something that they don't think is happening that's proper. Our Senior Medicare Patrol is a statewide fraud prevention for Medicare services. And what we do is try to educate people on how to keep their Medicare cards and their services safe. We also have a veteran-directed home service that allows our veterans in the area to hire family caregivers or other people that they know to take care of the issues, their cooking, their cleaning, those kind of things, and they can pay the people directly, and we act as the fiduciary on that piece of it. And our care transitions, which has been hospital to home support, is kind of weakening out. It was sponsored by the Medicare, and what they've said is that it was effective, great. Now we expect everybody to do it on their own, so we're kind of changing it into a home support group. We also have our nutrition program, probably the flagstone of what we've got in Missoula Aging Services, as our Meals on Wheels program. We also do liquid supplement that we sell at a reduced price with a contract we have nationwide. And congregate meals, which we hold congregate meals at the senior center that we sponsor, and we do a roaming congregate once a month as well, and rural nutrition sites in Sealy, Lolo, Bonner, and Condon. Of course, unfortunately, all those sites have been shut down since COVID has started, with the exception of the Missoula Senior Center is doing drive-up pickup, and Sealy Lake is also doing drive-in pickup on a daily basis. Hoping to get those started, but we really can't jump into that too fast. We do have such an aging population and people that are very susceptible. And then our Senior Farmers Market Coupon Program, which gives people a coupon to use at the farmers market for nutritional services. That one, we usually serve about 500 people a year. Farmers Market was not very effective this year for our age group. We unfortunately were only able to serve about 290 people this year. So we're hoping to get that onto the next year when we get back to some level of normalcy, I hope. So when I was talking about COVID response earlier, the biggest piece we've had on COVID response has been the nutritional piece of things. I've been lucky enough to be able to sit on a task force for food security in Missoula County, and we've got some great people who have helped work on that and work through some of the issues. But some numbers that are stunning once we put them together. 87,500 plus meals have been served by MAS that we provided through the senior centers or through our Meals on Wheels program since the COVID pandemic began. 900 people have received meals from us or from the senior centers, and we have done those meals at no cost. Primary reason we did them at no cost, we don't want money changing hand. It's too much close contact. So we went to the no cost and used some of our CARES Act funding, as well as some funding generously provided by the county. Our cost of meals since we started this COVID, over $500,000 in our meal cost. So it's a lot of money, but I believe we've really done some good work in that area, and I'm really proud of our team and our volunteer drivers and our partner, Thomas Cuisine at St. Pat's Providence, who does our Meals on Wheels provision. So how could you get involved here if you wanted to? We'd love to have you volunteer. When we get back to what the new volunteering is going to look like, I think we're going to have some great opportunities. If you want to help us get the word out, we'd love to have you join us with Advocate, and we can find ways to help you get involved in your communities and getting the word out of what we can do, as well as if there's needs in your communities that you folks need that you might see that we might not, please reach out to us and we can help you with those issues, what you're seeing. Love to educate people and refer people to services that might happen. And of course, you've seen those numbers on there of what we've spent on meals alone this year. We're always in looking for donations. We do need to raise about $500,000 a year in order to keep our Meals on Wheels and other congregate dining programs solvent, and we've had great community support for that. Any questions I can help with? Anybody got some questions or thoughts? I'm happy to answer.
Yeah, this is for Caldwell. I've got one quick question, and I should know the answer to this, but for your rural nutrition site in Bonner, where is that? Where's the site?
Right now, it's at Our Savior Lutheran Church is what they're doing. They're doing it 2 times a month before COVID hit. It's not happening at this point. And when we get back to it, we're going to look at making it more of a weekly process and try to do a little bit more streamlined food service. And the other piece that we're looking for that we found in that particular area is getting Clinton and Potomac also involved with trying to get some transportation issues solved and getting some ways to get people to those meals. They're not just a meal, they're the congregate meal, which means basically to get people together to be sharing the meal and have some interaction. That's as big a piece of our meals as anything, I believe.
That's where I would have expected it to be, but I was not aware of it. Thank you.
You're welcome. We were just about ready to throw out a big mailing campaign out in the Bonner area when COVID hit. We have a whole campaign ready to roll out with postcards and everything you can imagine, but we can't do it now. So we'll hold that until this thing brings us back a little bit.
Well, reach out to the Bonner Council. Maybe we can help you with that.
Well, I will absolutely do that. Thank you.
Sure.
Emily and Bonner, did you have a question?
Yeah, I did. You know, I mean, we're talking Missoula County here, but what is the outreach on some of the other surrounding areas? Or is that like, you know, we have family, friends, associates, you know, Mineral County, Sanders County, are you a good touch point for those people just to get them to where they need to go for some services that are similar to yours in their counties?
Sure. So according to the Older Americans Act and the funding that comes along with the Older Americans Act, every state has to decide how their Older Americans Act money is going to be set out and have area agencies on aging. Some states do it, every county has their own area. The state of Iowa, I believe, only has 4 area agencies. They're much bigger. Montana has 10. Missoula is the only one that is Missoula and Ravalli County. We farm our stuff out to Ravalli. They serve their own group through the Ravalli Council on Aging. But every area in Montana has their own area agency on aging, and we can absolutely help people get to get to the right people or make referrals on that site. But there is a service like ours elsewhere. Some of them don't do quite the broad range that we do. We're by far the biggest in the state. Our CEO, Susan Kent Kohler, has been with the agency for 36 years and has done a fabulous job turning us into what we are today. And it's a pleasure to work here.
And Jerry, West Valley.
Yeah, thanks. Really great information, Rob. Appreciate hearing all the great work you guys are doing. Similar question to Bert. Where is the hub in Frenchtown?
So Frenchtown has their own group. They have a group that is not sponsored through us formally. One of my staff members is on the board there, and we have started giving offering to pay and support people who are not able to afford those. And we're looking when this thing comes back to try to provide a little bit stronger support. It's a strong community. They solved a lot of their own problems. They like that. We love that idea and don't want to push our way in. We want to follow the community. What we found in Sealy was fascinating. When we moved our first person up there, she was not a local, and it didn't succeed. We had to find a local person who knew the program and knew the people. Once we got that in, she's been absolutely flying through. We only had her half-time to start with, and she's full-time now with other supports up there. So we like to go community by community in what they want. It's not our way to decide.
Thanks. I know we have Tom is on the phone with us, and he is an active participant in the senior citizen luncheons. And I've personally gone to a few of them, and I have been amazed at the turnout. There's anywhere from 50 to 70 people that,
I've been lucky enough
go
to
to
be
the
invited
lunches out there.
Invited to
Yeah, you'll have to come out for lunch and bring Debbie.
Yeah, well, Debbie's on the board there, and then Kate Cotner, who's one of our resource specialists, is a strong one out there as well. Great program. We just want to find a way to help more.
Thank you.
Looks like Tom and Sealy has a question. Tom Broder.
Sure. Thanks. I know when the stimulus payments came out in April, May, and then some of the programs like pandemic, unemployment assistance, there were people, both seniors for the stimulus payments and maybe small contractors, that some of us just helped informally. So I guess my question is, did your group get involved if, seniors didn't get their stimulus payment, trying to track that down? And since we may have that happen again, it might not be till the first of the year now, will you have a program, or would you need volunteers to help people do some of that, administrative, logistical, kind of online work to get their money?
So that's a great question. So when the stimulus came out, the call volume into our call center, which is manned 8 hours a day, 5 days a week, we did close it down for the first couple weeks of the pandemic, but it's been staffed ever since then. Those folks were getting an awful lot of questions about the stimulus. And what we did is we put together some base information that our call center could provide, how to access that, how to help, how to do that. If the people weren't able to, we set them up with one of our resource specialists to do a phone interview to help them at that point. We've got all sorts of phone interviews. We're on Zoom. I feel like I live on Zoom. It's been helpful, but it's been very, very odd in the same way. But you can see I'm in my office. I'm one of those few who, because of the nutrition program, I never had to work at home, which was a good thing, because I had 4 teenagers all at home trying to complete first year of college and first year of high school, as well as a wife working at home at the same time. And I think for the sake of our marriage, I'm glad I was able to be in here and keep that there. I know my wife is, so. Any other questions for me?
Rob.
Thanks,
Great.
Rob.
No other questions, please feel free to give us a call. Reach out to me in particular if you have a need. Our call center is 728-7682, manned by live people. You'll get a human being if you call during the day, and they'll be able to transfer you right to me if you want to talk to me. I'd be happy to talk to your groups. So thank you for the invitation, and I appreciate the ability to have this conversation. So thank you.
Thank you.
All right. Bye.
Deb and Erik?
All right,
Erik,
I will.
first?
I'll go first. So I guess this time of year, it's really no surprise that we are heading into our winter maintenance season. The event this weekend kind of caught us a little bit off guard. We were hoping to get some more time through the fall to finish up some project works, and with our road maintenance projects, we try to spread our work out to every bit of the county whenever we can. This year we were able to do some hard surfacing projects up in the Swan Valley and Seeley Lake. We put some millings on gravel roads to provide that hard surfacing, cut down on dust, and hopefully provide more long-term stable roads. We did that work off of a planned project that MDT had on Highway 83 North, and toward the middle of the summer, we picked up some surprise millings, and we were also able to do some hard surfacing projects at Kramer Creek out at the Beavertail exit and on Remount Road up 9 Mile. So and then a small project on Lower Miller Creek Road. So we do the best we can to provide those stable surfaces, especially on gravel roads. So converting those into a hard surface road hopefully is a benefit and a joy to the people in those areas. Will reduce maintenance for us, so we'll have that hard weather surface all year round. And so we did get those projects done. We also finished up a couple bridge projects out in the Frenchtown area. We had a Treasure State Endowment Program. They call it the TSEP funding, based on the coal severance gas tax, and coal tax. And so we were able to leverage a $500,000 grant to get two bridges replaced for a total of $1.2 million. So we had a little over $600,000 in local funds that provided access to the elementary school and to an area on Bible Lane that there's one way in. So we do our best to go after state grants and work with MDT for off-system bridge funds to work on those replacements. And you know, the bridge fund from local tax dollars has always been pretty stable, and we are able to work within that budget to take care of the smaller projects. But it's these bigger projects where we're looking at several $100,000 per crossing structure that we can work with the state to get that work done. So that's the short-term work that we finished this summer. Long-term, we worked with the city and the MPO. If you're not familiar with that term, that's the Metropolitan Planning Organization, and they are the coordinating agency to distribute federal funds between the city, the county, and the state in the urbanized area. And they had a project planned to conduct a pavement assessment in the urban area. So we jumped on board as long as there's a consultant in the area. We conducted a county-wide pavement assessment program, and we just got the results back June and July. Those numbers really started coming back in, and from our consultants' analysis, they show that we need about $3 or $4 million in our asphalt budget to just maintain the current level of pavement condition that we have. And as long as I've been here at the county, which is 19 years now, our annual budget for asphalt maintenance was about $350,000. So you can see where we are definitely falling short. So fortunately, we had the local option gas tax passed this summer. We project that revenue at about $500,000 once we begin collecting on a full annual basis. And on top of that, we had the previous Bridge and Road Safety and Accountability Act, they commonly call it the BARSA Act, where we get additional revenue from statewide gas tax, and that this year we received $363,000. And this was unfortunately an odd year. As everyone knows, we had concerns about the revenue with a lot of people maybe out of work and not able to pay their property taxes. So the work that we did this summer with the millings projects and some small paving projects were just about entirely funded by BARSA. So moving ahead, we're looking at, from 3 years ago, having a potential amount of $800,000 extra in revenue, and we'll be able to use that for our asphalt maintenance projects. One thing that we've been wanting to do for a long time but have never had money for would be a chip seal project to complement the asphalt work that we do. The other thing that we would like to do, because it is so popular, is hopefully we can spread some of that money from the local option gas tax to expand our dust abatement program. Always a very popular program. So we're going into our planning season to see how we will be allocating our bonus revenue going into calendar year 21. So one thing that I would always like to say whenever someone calls me, and I'd like to remind everyone that we're not on every road every day like you in the community councils may be, or the more rural areas. And so if you have issues, if you have problems, if you have requests, if you see something, please let us know. A lot of those things that we can't take care of if we don't know about, and we could be several weeks from being on a road and seeing an issue. So we always appreciate the input from the locals that are there every day and know what the road conditions are. So hopefully that is a brief enough summary, trying to keep an eye on time, and gets our work covered.
Did Deb have anything to add? Ooh, sorry about that feedback.
Deb, you're still muted. There you go.
Okay. So I'm going to kind of keep with the vein of COVID and just let folks know that the building division is starting November 4th, which I know seems like an odd day, but we are closed for Election Day, November 3rd. And we are not going to open back up. We are going to pull back our main office which is located at 6089 Training Drive. That's the main Public Works Administration building. All of our permitting is available online for folks. So we are going to allow that to continue. We do have a drop box outside for picking up and dropping off permits. Our staff will be in the office, but we're switching gears and pulling back due to the rise in COVID cases and concerns that our staff has as well as the public. So just want to let everybody know that the Sealy Lake Satellite Office will be open for appointment only with Dennis. And that is his office hours and his phone number down here. You can call him for an appointment. We're available, like I said, email using our permitting online software. Our drop boxes and pickup boxes will be out there for folks during our regular business hours. It's just, that we think this is the right thing to do at this time to keep our employees safe. We will continue to do on-site inspections. All of our inspectors, have the appropriate PPE when entering homes. We ask that homeowners also wear face coverings during the inspection and maintain a 6-foot distance. If they need to have a discussion with the inspectors, we ask that they have that either outside or over the phone. And we are, strongly encourage everyone to take these measures seriously as we are trying desperately to stay open for folks and keep the construction industry, rolling and moving along. So just want to make everybody aware of that. And then I also had some permit stats for folks as well. So in FY20, we had our first quarter, we had 781 permits that were issued. So far this first quarter, even with COVID, we've had 846 permits issued. Our revenue is also up slightly. So, we're rolling. We're open for business and we are rolling. And even with the small slowdown of things during the first part of the pandemic and everyone kind of pulled back, we weren't quite sure what to do. We've managed to make up for that lost time. So I think we're on a good place right now moving forward, and I'm happy to take any questions anybody might have.
Our ranch manager was so appreciative that you guys did printing, so he didn't have to drive into Missoula. So thank you for that. He says that he couldn't find it on the website that service was available. So thank you.
I can highlight it if you want.
That would be great. Thanks so much.
Yes.
And Erik, I have some cranky neighbors who live on Sunset Hill Road, and they were so appreciative of the grading that happened right before the snow populates. So thank you.
Oh, you're welcome. I hope it lasts as it melts now, but we will be out with the break in the weather, hopefully a little bit tomorrow, but certainly into next week to get to some of those gravel roads that we did not get a chance to touch up. We had that period of rainy weather in the middle of October, and then that went right into the snow and 0-degree temperatures. So we'll try to get everything dressed up in all the areas.
Tucker.
Tom Tucker, do you have a question?
Well, yeah, Erik, when do you plan on addressing Hoole Creek Road? I know the weather wasn't cooperating with you, but it's getting pretty nasty.
Right. So I assume you're talking about the immediate need of the gravel, or are you talking about paving, or both?
Well, paving would be nice, but that ain't going to happen. It hasn't happened for 42 years. But the point is, the potholes are so bad. I've already got a $2,000 bill I got to do to fix one of my rigs, and I'm driving, about as fast as I can walk. Potholes are getting terrible, and I don't know what the bus drivers are saying to you, but
I haven't heard directly, but usually they stay in direct contact with our road supervisors. So again, with the break in the weather, we're supposed to be back into the 40s and 50s through next week. So we will have our graders back out. Hopefully get those touched up one more time before the rest of the winter sets in.
Well, I know I would appreciate it, and several neighbors would too, and I'll thank you for that in advance.
Sure.
Does anyone else have questions for our public works staff? I think we're good then. Thanks so much for being here, Erik and Deb.
Sure. Oh, I think Bert is saying something, but he might be muted.
No, Bert was just shaking his head saying, no, I don't have any questions. But
Oh.
Thanks, Erik, thanks a lot. And Juanita, thanks for noticing.
Thanks, Erik and Deb. Looks
You're
like
welcome.
we have Nick.
Hey, good evening. Thanks for having me. Appreciate it. So I'm going to talk a little bit about an emergency preparedness application that we have at Missoula County. It's called Smart 911, and we encourage everybody to sign up for it. Smart 911 really has 3 prongs. It's emergency alerting, family safety profiles that pop up on 911 when you make an emergency call to 911, and smart prepare, and that's the bigger piece of the emergency preparedness part of it. But all 3 of these components sort of interface and integrate with each other and talk to each other. So it's a really great system. And I'll start with the alerting piece. So as we get into the era of cell phones, there is a growing emergency alerting gap in the country and certainly in Missoula County. More and more people are getting rid of their landlines, and we have landline information automatically in our system, so we don't have to get people to put that in to provide emergency alerts to landlines. However, cell phones, mobile devices, that's a voluntary sign up for emergency alerts. So we encourage everybody to sign up, and we are limited by the amount of people that sign up. And as there are less and less landlines and more cell phones, that means we're able to alert less and less people unless they're signed up. So what do we use alerts for? One of the big things is evacuations. Remember in the fire year in 2017, we had the Rice Ridge Fire, the Liberty Fire, and the Lolo Peak Fire. Well, we put out exactly 56 evacuation notices that year. And each time we put out an evacuation notice, we had to put it through Smart 911, and people were able to get it via however they signed up for it. You can choose to get it via text, email, or a phone call, or any combination thereof. So we put out 56, and the reason for that is because the Lolo Peak Fire in particular had about 14 or so evacuation zones as the fire moved down Highway 12 and then down south on Highway 93. And so we put out an evacuation notice for one zone. Then we put an evacuation notice out for the next zone, and then the next. And then we put out a notice to the people in the first zone, letting them know that it was okay to go back in. So that ended up being a lot of evacuation notices. So it's a really important thing to get in that instance if there's a fire bearing down on you. And we encourage people to sign up, but we also always see a lot of people sign up during fire season when there is fires in their particular area, and that's fine. We'll take anybody aboard any way we can. So another part where we send emergency alerts out is for missing people, missing children in particular, and missing seniors in particular. And that has really helped us find a lot of folks. We sort of put out an alert for a missing kid in a neighborhood, and we get eyes out there looking for the child, and it's sort of a crowdsourced way to find a kid. And so these alerts, they are targeted to a particular neighborhood. We can do them just using street lines right down the middle of a street, or we do polygons or a radius. We've used we had an armed gunman a couple of years ago in a neighborhood, and so we put a 1 mile radius around his last known sighting and alerted people to lock their doors and shelter in place at that time. So it's been really used quite a lot, and it's a great system for that. But it's also the second component of Smart 911 are safety profiles. And safety profiles allow people to go into the system. First of all, to sign up, you go to smart911.com and follow the prompts and put your information in. But you can create a safety profile that'll pop up on a 911 dispatcher's screen. Whenever you call 911, that dispatcher will see that safety profile and relay relevant information to responders en route to your location so that they can really tailor their response to your needs. And the type of thing you might put in there is home information like shut-off valves for your utilities, bedroom locations. For example, if there's on my personal safety profile, I have it shown that on the second floor, southwest corner of my home is where my son, that's where his bedroom is. So in the event of a structure fire, look there first, please. So they'll know that. That'll pop up to the top. That'll rise to the top, and they'll relay that to firefighters en route, and they'll look there. You can also put medical information in, including things like medications, allergies, conditions, physical or mental disabilities. You can put special considerations in, language restrictions, vehicle information, notes about, say, a dog that might be really protective that responders need to watch out for. So you can really put a lot of different things in. You can put pictures of kids in, pictures of your family members in. So that might be helpful if, in the case of an abduction, and so they can get that picture of that child out to responders very quickly in that event. But you can really put as much or as little as you want in, and it's your choice how much to put in. And this is private information, it's protected information, and it's secure and free. So we've checked and done our due diligence to make sure that is the case. And the third component of Smart 911 is called Smart Prepare. And so by default, your information is only shared with 911 dispatchers when you make a phone call, nobody else. But you can check a box that will allow you to share your information with the other side of the Office of Emergency Management, Disaster and Emergency Services, it's called. And we use that information in order to find out who may need a little extra help in the event of an evacuation. So, for example, during the Rice Ridge fire, when an evacuation was called for Seeley Lake, I did a query of the system to find out who had self-identified as having a disability, a physical disability, or an access and functional need that may require us to provide a little extra help to get them out of harm's way. And that worked really smoothly, and it was great. Also, you may recall the windstorm in, I believe, 2015, where there were blackouts around the city of Missoula in various neighborhoods. So what we would do is put a polygon around that neighborhood that we know is blacked out, and then I did a query for people who reported as being reliant upon a powered medical device because we know the power's not working. So we were able to check in on those folks and make sure they were safe. So this Smart 911 really has a lot of good applications. They talk to each other. It's really sort of the gold standard of alerting at this time. We encourage everybody to do it because it is a voluntary thing. So this is how you're going to get your alerts. We have, when somebody calls into 911 and we're able to use the information that we get from Smart 911 to in a response that actually saves a life, that's called a smart save. And we have seen that in Missoula County, and we have seen it in other parts of the country as well. The Smart 911 system is available to other parts of the country. And so that's sort of a big deal, and we're pretty proud of that too. So encourage everybody to sign up at smart911.com. It's a very easy process. Have had a couple people that have had a few problems with it, not because of Smart 911, just because they may not be familiar with the system. So they call our office usually when that happens, and we sort of guide them through it, and we're pleased to do that. But we are very encouraging of people signing up for that. And with that, that's all I have with that. If anybody has any questions.
I have a question.
Hey, Bert.
I think
Go ahead.
that's actually Klaus. Start with Klaus.
Oh, sorry, Klaus.
Just out of curiosity, you mentioned abductions. Have there been any?
I can't recall one specifically in Missoula County. They do happen throughout the state from time to time, and we get a really loud alarm on our phones when an Amber Alert goes off. There, of course, has been a lot of scares, and there has been a lot of missing children, and I don't believe that any of those recently were due to abductions. But I mean, I had a scare with my own child one time, and I was about a second away from calling 911 and when I found him, but I was really pleased that and thinking back on it, that I did have his photo information in that system. So it's comforting to know that.
Thanks.
Okay,
Yep.
so now it's my turn, right?
Yeah.
Okay. I had somebody from the emergency management and from 911 come talk to a little group of ours a while back, and I found out something I never knew before that everybody should know, is that when you call 911 and they're asking you a lot of questions and trying to get information from you, and you're concerned that they're not sending somebody, generally there's another person there who is already on the go, sending somebody to you while this first person is asking you questions. There's no lost time, I guess is what I'm trying to say.
Hey, that's a great point, Bert, and that is 100% accurate. That is exactly what they do. They just keep you on the phone in order to get as much information as they can, so that they can provide it to the folks that are responding, so they can tailor their responses best possible to your individual situation. And by the way, what do you think a question for you folks, what is the most important thing when you make a 911 call? Little trivia question for you. Location. We can, the more information we have, the better, but if we can't get to you, we can't help you. And so Smart 911 also has some GPS information in it, and that's how we did our Smart Save, by a dropped call that we had GPS information and we're able to find a person. All right.
Awesome. Thanks so much, Nick.
All right. Thanks, folks.
Yeah, thanks a lot, Nick.
Smart 911, everyone. We're all rural community councils. So this is Sarah and Laurie are taking this one.
Laurie, start off.
Who did you want to start off with?
Oh, so we were going, hi. We were going to talk a little bit about just the status of how the virtual community council meetings have been going. If there's any help that the county, either the commissioner's office or CAPS can give, any advice, anything like that. We just wanted to see how it's going, basically.
I'll speak to it from Bonner. Okay. Yeah. Go ahead, Juanita. Laugh. I'm going to talk every time, no matter what. Okay. Yeah. Bonner has done mostly on, well, almost exclusively on Zoom, and we've had about the same amount of attendance that we had prior to that. The only difference is that all of our meetings now are limited to 40 minutes, and that will change soon. We're going to go ahead and get a subscription, which will allow us longer meetings. And on a couple of occasions we needed it, but most of the time we can rattle through it quickly. And on Zoom, people tend to be a little more concise. So that's it for Bonner.
Want to hear about Sealy Lake? Yes, no?
Yep, no, that would be great.
There's nothing particularly earth-shattering to say. We have Zoom meetings and they work well. We had 20 attendees last time. which I thought was surprising. So we're really happy doing it that way. And the advantages, right? Like you can show documents easily, etc. So we'll be on Zoom for the foreseeable future.
Thanks, Klaus. Lee Bridges in East Missoula raised her hand.
Hi, can you hear me okay?
We can.
Great. We are also using Zoom. We have a subscription, so now we're able to have our meetings go as long as we need them to go. Our attendance has fallen a little bit. People aren't quite used to they haven't gotten the hang of Zoom yet. I'll have to work on that, but we're still having really successful meetings and plan to keep doing that within the foreseeable future.
Thank you, Lee.
Thanks.
Kevin, how about you and Kyla?
Yeah, so we've been doing a little differently. We've been having hybrid type meetings where we've got in person and we've been using Google Meet. One thing I probably want to change for our next meeting is sometimes the camera's not always facing if we have a presenter in person, so it makes it a little bit confusing. So, and that's an operational error on my part. But we have a lot of folks that want to be in public, so we worked with Cindy at the health department, and she went ahead and gave us her blessing, if you will, on what we're doing in person. We're able to social distance, have masks, have a sanitizing station. The community center where we meet has done a very good job of preparing the facility and doing their sanitization process, so it's clean and neat and safe for everybody. So I feel like that's really working well for us and our needs. And when our presenters want to come, we give them the option if they want to be in person or if they'd like to participate electronically online. And for the most part, they're excited to come and be in person. So I think that's going well for us.
Kevin, how many people can you have at the community center in person?
We could safely have, well, Cindy told us if it's more than 50, we need to make a change with our plan. So we've been having less than 50. We can set up a little bit over 50 seats if they're 6 feet apart, social distance. But we've only been having maybe 20 or less in person, and then with a half a dozen, 6 or 7 in electronically participating.
So it might be worthwhile to reach back out to Cindy with the new regulation. So 5 and less.
We'll just try to meet the goal of that lower number for 2 weeks and call it good. Yeah, I'll reach out. Let's touch base with her and make sure we're still kosher.
I have a question that's sort of for everybody. We record the meetings, and we've had a lot of success with people actually listening to the recording. Surprisingly, something as dry as a community council meeting. Does anybody else have any experience in that regard?
Bonner had been having the MCAT record hours for several years up until the COVID hit. And now we're just recording the Zoom program. Haven't had anybody actually, I know we had people watching it from time to time when it was on MCAT. Haven't had a call or an email or anything about it since we went to Zoom, though.
I might add that our council live streams them on our Facebook page as well, and then that gets shared far and wide.
Yeah, same with us, right?
Good.
And Jerry, how about West Valley? Are you able to meet at all, or is the fire station still?
Fire station is still a no-go, and the committee the council opted to not meet. There's some internet issues out here that some of the council members couldn't be part of the meetings anyway, so we'd never have a quorum basically because 3 people have terrible internet out here.
Amen on that.
Before I forget it, I want to give credit where credit is due. Tom Browder is really our tech wizard, and he put all of that together. So we really owe him thanks for doing it. Thanks,
Well,
Tom.
thanks for that, Klaus. One thing that I happen to be working with an MCAT videographer a few weeks ago, and I said, well, because they've got the public access channel, would you come up to Sealy? But we're outside the area they tend to go to. But as Klaus mentioned, the nice thing about Zoom is you can download either the full video and audio, but what can work better is just to download the audio, and then you can put it on your Facebook page, wherever you want to publicize it. So we're big Zoom fans up this way.
Jerry, who's the internet provider in Frenchtown or your area?
So there's a number of them. CenturyLink is really slow. Cybernet is pretty good, but up where Tom lives, Cybernet can't get there because of the mountains and the trees. And that's really part of the biggest problem out here, is that we're a little bit lower and we're hampered by just hillsides. And so it makes it really tough. We personally have Cybernet where we are, and it works for us, but Tom is really, he's on a hillside and his internet is ridiculously slow. I mean, he can attest to how slow it takes him just to download, for gosh sakes, an email message.
Mm-hmm.
Yeah, I get 24 kilobytes, sometimes 53 kilobytes. I'm paying for 1.5.
Oy.
And that's why Tom is on the phone, not
Yes.
on Zoom.
And maybe, Laurie or Sarah, what happens up in Condon? Is that the same situation with Condon, or what are they doing with their council meetings?
They haven't been meeting, I don't think. I think they have the same kind of internet issues. So they're just kind of on hiatus as well.
Yep, that's my understanding as well.
Okay, thanks.
All right, Laurie, did you have anything else on that?
Nothing really. I think that just a reminder that if any other council that wants to actually subscribe to the fuller, more robust Zoom subscription, that is something that your budgets can pay for. That's allowed. So just keep that in mind. There's also a transcription service that you might be able to sign up for if you're having difficulty doing the transcription from the Zoom meetings or whatever virtual platform you're using. And if that's something that you're interested in, we can give you some more information. I know the commissioner's office has been using it. We've used it a few times in the CAP's office. So that is something that would be easy to use, and it's actually pretty accurate and pretty nice to have. So just another food for thought.
Thank you, Laurie. So if any of you need assistance with virtual meetings or transcription, feel free to reach out to Laurie Hire or myself. All right, so the next thing on the agenda is just kind of a quick introduction to Kyla. So this is Kyla Lehnerz. She's our new administrative assistant in the county commissioner's office, and we're super excited to have her join our team. Kyla will be taking over board membership management in January 2021, and I'll be stepping away from it. So Kyla Lehnerz will be your go-to person for board membership questions. I believe she's going to staff the next 2 community council meetings that we have with you. And So I just wanted to take this time to introduce her. Kyla, you can say a few words if you want.
Hi, I started in September, so I'm fairly new to the county, but I am born and raised in Missoula, so I'm very happy to be a part of the team.
She's super smart and doing an awesome job. We're really grateful to have her here. So I know you all will be in good hands with her taking care of your meetings. And then just another note for the next upcoming meetings, we kind of adjusted them around holidays. So instead of falling on the 4th Wednesday, we moved them to the 3rd Wednesday. So the next 2 meetings will be November 18th and then December 16th. So does anybody have any questions about that?
Just again, out of curiosity, when you're stepping away, what are you stepping into?
So I've transitioned fully into the communications department, still in the commissioner's office, but providing more communication support to other county departments. My new job title is communications coordinator, so working on press releases, media, all sorts of different communications for the commissioner's office and county departments.
As long as you still got the same phone number, it's okay.
Same phone, email. But yep, I'm still here if you need anything, but I know Kyla will do a great job.
Congratulations.
Thanks, Bert. But Juan, did you have anything else for everyone?
No, I didn't know if you wanted to run down the list, if there's anything that folks wanted to add or share. And then, yeah, we're going to get out of here before 8:30. Nice job, folks.
All right.
Questions?
No, none.
No.
I will say again that as far as I'm concerned, that these are very valuable meetings. A lot of information and a lot of, I guess, camaraderie, if you would, even though it's on Zoom. It's important. Thank you.
No, they're good. I agree.
I would echo that. I think that these are really helpful, and I think the opportunities to ask questions from each community is really relevant. And I think we learn so much at these meetings just from what other councils are doing, and just generally hearing from the guests that have that we've had. I think it's been really useful, and I know that everyone's hope is to get back to some sort of normal, but I would hope that in the future we would still be able to have these meetings at least quarterly, because I agree with Bert, they've been really valuable.
Mm-hmm.
Yeah, well said, Jerry. I feel the exact same way. It's really always so great to see you all and yeah, hear this information folks are sharing.
If any of you have agenda items you'd like to hear for next month, feel free to email myself and I will pass them on to Kyla.
Well, thanks everyone. Have a great evening.
Thanks. Great meeting.
Okay.
Have a happy Halloween.
Thank you.
Happy Halloween. Be safe on that blue moon.
Yep.
Saturday.
Yep.
Blue moon, Saturday, Halloween. It's just be safe.
Thanks.